We are very lucky to have Darren Hotton with us today. He is the Community Outreach and Volunteer Manager at Utah's AARP, and he has over 30 years of experience in aging services. He's passionate about helping older adults age with dignity and choice and building partnerships that make a real impact. With that, I'm very happy to turn the time over to Darren so that we can learn from him.
Thank you, Heather, and welcome everybody this afternoon. Um, so let's just get into this. All right. So ARP Utah has, I just want to give you some information the very first. AARP has this caregiving presentation, and it really fits all different types of levels of caregiving. Because we most of the time we think of people just normal caregiving, but in this particular one with dementia and dementia related conditions, it can be a little bit more complicated, but at the same time we're following the same basic guidelines with the AARP Utah provides resources to people in the state of Utah to help with caregiving. And, we all have stories of caregivers coming into being a caregiver, or you're now a care receiver, and you're just kind of stuck at where you're at because you don't know where to start to find information and or where to go. And some people are just at a loss. Unfortunately, most of people go and just start talking to friends, and friends are a good source of information, but not the total source because they're missing out on other things that all of us that are in this big group have access to. It's just the hard part of sharing all those resources. So at AARP Utah, we're all about championing the boots on the ground, the people providing the services. So if there's ever a possibility or a reason you need to help with these resources, please let us know that we can give you links to our web pages or to booklets that we could send to you and other presentations and stuff like that. Because one of our main things this year coming up in 2026, we're going to have two major media things with AARP. One is on fraud and the other will be on caregiving. So, of course, since it's Caregiving Month next year in 2026, AARP will be championing that with a big media outreach for caregivers in 2026. So, here's our agenda today. We're going to go over these particular topics, and hopefully, I'll be able to answer all your questions. If not, I have Kate and Christy with me to help with that too. All my friends back at Health and Human Services and Division of Aging and Adult Services to help back things up. But let's get started. So, the founder of AARP put this quote out there for caring for others. It is only in the giving of oneself to others that we truly live. The human contribution is the essential ingredient. When I think of the things that I've done over my entire life, my life has been spent serving other people. So, um, when I was younger, I helped serve my older grandparents at the time. My wife was helping foster kids, and so I would help with the foster kids. I moved into aging, and after that, I've been helping with the aging network since then. And it's truly just the feeling of giving of oneself to others is always such a great feeling, especially in a world where everything is so down and so negative. It's important to understand that what we're doing is truly giving of ourselves to help somebody else. And I just wanted to give you guys a pat on the back for all the great stuff that you are doing and what you're helping with, because you provide services, you provide support, you provide information and education, and you're helping care receivers get the best care. But at the same time, we're giving of ourselves to other people, and there's no greater reward than that. So I want you to think about something real fast. I want you to um, close your eyes and think of all the different tasks that you have on your plate currently. Let's say If you are a caregiver, think of the person who you're caring for. So in this case, I'll think of my father-in-law, and then I'll think of my dad and my mom because they're getting up there too. Um, I'm thinking about things that I have, that the many tasks that I have. So, have you got this thing in your head about the person you're helping? Let's throw some more tasks your way and see how you start to feel. So, let's throw in doing laundry. On top of that, now we're going to throw yard work, and you haven't been helping them with the yard work, but the yard work needs to be done. What about those times that in this my case, my dad starts taking the medications on the wrong time, either morning and night, and he's getting them mixed up. So now you have to pull back the medications and help them with their medications. What about providing food? Um, they're not able to cook for themselves anymore. So are you helping them get on Meals on Wheels? Or are you going to the store and buying them food and hoping that they're making their food themselves? What about personal care? Are they taking care of themselves? Do you have to help them bathe where you haven't had to do that before? Are you making them get up out of bed? Then you throw in some other fun stuff like bills. Everybody hates to pay bills, and I don't know why you'd want to take on somebody else's bills, and that it can be quite the challenge. So as we go to the next slide here, I just want you to think about all those the balls that were in the air at first, and then you started to throw on all these other ones. So you threw in the medication, you threw in the yard work, you threw in the helping them get out of bed and take care of their beds or to change their linens and stuff like that. Where does it get to the point where you just can't juggle anymore? Or if you're going to throw more on, so let's say you're doing work, but you still got to go to work. And then after you go to work, you got to go pick up kids from soccer, or you're helping them with their medication, and now you got to go pick up the medications because before they would get them. All these things we have to juggle. And that's what, with caregiving, it gets so complicated is because each step involves another ball that's thrown into the air, and you're just trying to juggle. At any particular moment in time, you're going to see how many balls am I able to juggle? You know, when is enough, or when can I do enough, or when is it just where all the balls are going to fall because I just can't manage all that stuff? And that's a question that most of us have, but we just feel that we have to keep adding those balls to juggle. We just know that I'm a caregiver, I have to keep doing this. And after overwhelming, even though it's overwhelming, we know that we're just going to keep adding another ball to our list of things that we're juggling. So, in this guide that we have through AARP, called the AARP Family Caregiver Guide, we help navigate this journey. And so, we're going to build a framework of how this works. It's a free booklet. It's 20 pages. That's the web page that's on our screen. It's in English and Spanish. And I'd encourage you to download it and look at it. We used to have a larger book, but those aren't in print anymore. But um, there are a lot of resources and Prepare to Care. So let's go to the next page and see what this caregiving framework is and what we should be doing, especially with people with dementia and Alzheimer's, because we know that it adds another element to this framework that we have to get into place to help make it so it's easier to juggle all the tasks that we have in place of us. Okay, as you can see here, we're going to talk about this particular framework that's here. We're going to do an assessment help. We're going to have important conversations, needs assessment, a caregiving plan, and life after caregiving. Um, Unfortunately, my aunt was a caregiver for the last 10 years, and now she has stepped into the life after caregiving. Her husband passed away on Halloween, and so I was up at the funeral, and it was interesting to see her where she came up and she just says, I just don't know what to do anymore because uh, I'm not a caregiver. And it was an interesting conversation to have with her about how life after caregivers or caregiving, she hadn't thought about it. It wasn't important to her. She thought she was going to be caregiving for much longer. And so this is part of that conversation. So let's go into the first one. The first one is assessments, and assessing one's situation is always eh, it's always helping your loved one's situation by creating a plan so that you don't feel overwhelmed and you're not alone. But as you go through this assessment, you're looking at the situation of the person you're caring for, and you've got to build a plan. So, first, you have professionals who are part of this. You have doctors, you have therapists, you have social workers. You know, they're here to help us. And what most people don't think is they just have to go in and do everything for themselves. And they also think that it's taboo to start to talk about end of life situations. And those types of conversations, for most people, they'd rather just stick their head in the sand and not have that conversation. But what happens is you have this crisis. And then when the crisis comes, then you have to have that uncomfortable topic of let's get into this stuff to help with the caregiving needs now. And it can be challenging, it can be scary, it could be terrifying because you're talking about end of life wishes. But if you push this off, it makes it harder and harder to where somebody might get offended, might get upset, they might get overwhelmed. You know, other people say they're too busy. It's just part of these conversations that you have to talk about with loved ones, and especially with people that have dementia and Alzheimer's at the very first. It's important to know about their concerns, their wishes, their types of feelings. So it's always important to talk early and often. I know this doesn't sound great, but I had to force my wife's parents and his grandmother to go to a restaurant and sit there in silence until they finally decided to talk about her end of life care because she was getting to the part where she was having troubles with her memory and she couldn't live on her own. So they finally went there, and after 30 minutes of silence, they started to talk about it. You need to do your homework first. You need to involve the right people. So, are you having conversations with the proper family members? Are you doing research online? Are you talking to a friend or a lawyer, a social worker, doctors, all those types of things? As part of these conversations, you need to focus on a direct versus an indirect report. So some people are very straight to the point. Let's get these types of conversations going. But there's other ones that just avoid certain topics and they just rather do the indirect report, an indirect approach, sorry. And so as you're having these communications, you're going to have, if you want to talk about estate planning, do you have any advice? You can ask them what they think. Or do you read articles and share stuff about that to them so you don't have to have that conversation? You know, just think of the type of people that are in this conversation and how they like to converse about it, either directly or indirectly. You have to be respectful and loving. I know sometimes it gets difficult. When a person with dementia starts repeating things over and over again, people want to take it personal, like they're not listening to you, that you're just talking to yourself, but it's out of their control. You need to be respectful and loving because deep down inside, they wouldn't want it to be that way either. And, it's not about power. This is about conversations to help with that person's wishes for now and in the future. And we need to use I statements instead of you do this and you need to do that, or you just have this. We need to put it in I want to help you. I would like to do this. I, so it puts the other person at ease. And then the last part would be listening and validating what everybody's bringing up during this conversation. Everybody has different thoughts, different values, different opinions. And this is where you have to listen to that person's side and you need to validate it at the same time. Now, it might be a little off, but that's okay. They're entitled to have their opinion. So, if you have realistic expectations during this important conversation, you're going to be able to get most of the stuff done. Now, you won't be able to resolve everything, but over a series of times with this conversation, it will get easier to have the conversation, but it'll also be easier to get things done. So here's the needs assessment. Whenever you are on this journey, it's important to assess your loved one's needs and find out resources that they have now and how to address their needs and identify gaps with current resources that aren't being filled and those gaps that will become a crisis in the future. As you look through this, you can see these building blocks of things. There's so many different ways of making this assessment because what might be something going on right now may change in the future because everything changes over time, especially with people with dementia. They may be fine for a certain amount of time, but after a while, you need to reevaluate that situation. My aunt was a wonderful lady, and she was diagnosed with dementia, and she was going through 4 or 5 years, and they knew they had the diagnosis, but things didn't really change. But then small, simple things like leaving the stove on or losing track of where her dog was or going outside and not remembering how to get into her house, that's where things started to be needed to be reevaluated. So what may be an issue now might not be an issue in the future, or maybe a future in the maybe a problem in the future. So if you feel like you have a bunch of areas under control right now, focus on the areas of greatest concern. So let's say the health and finances are okay, but your skills and socialization parts aren't too well. So focus on the concerns because those things are going to change over time. That person may be able to drive. Transportation is not an issue, but will be an issue in the future. Or finances may be part of the problem in the future, and also that housing. You might have to change situations. So let's talk about assessing finances. Money can be a particular sensitive topic when you talk about it, and is often at the heart of many decisions as you make it with you and your loved ones. So, as you assess one's current financial situations, think of it as in these terms: income. Is there employment, retirement benefits, any contributions by family members? I have seen where family members don't want to be part of the day-to-day operations, but they're more than willing to make financial contributions to help out. And most of the time, people didn't know that they would do it, they just didn't ask. So if there are people in place that can make that contribution as a family member because they're not physically present, it doesn't hurt to ask. Savings. What about, oh, sorry, that one, there we go. Savings. How much do they have in stocks and bonds, investments? Debt. What is their debt? My father-in-law was married, uh, and he's been disabled, but his wife put them into debt. And she didn't share how much debt she had as her health declined. So as we came in to help, um, even though he didn't have a mortgage, we found out that they had several credit cards that were maxed out that he was unaware of, and it was under his name. So how do we go over and help them with that particular debt when she passed away? And then normal stuff like housing, utility, transportation, insurance, all the normal stuff of being adults, food, discretionary spending, and so forth. You have to talk about these things. You have to determine if you have enough of those money and expenses to, savings and income to cover that debt. And if not, well, what happens then? Do you need to look into other resources to see if you qualify for assistance? Does the person qualify for veterans benefits? Do they qualify for other types of help if they don't have enough funds, income-wise, to help with the budgeted expenses? And then it might be good to take over or recruit a family member to manage their finances. Um, it doesn't mean just because you're the caregiver that you have to be the caregiver, the barber, the maintenance person, the yard crew, and the financial manager. It's okay for you to recruit other family members to do this. And of course, you want to make sure that they're a good family member and that they're doing the right things, that somebody else has access to those accounts. Because unfortunately, in the state of Utah, the people that take advantage of care receivers is family members, and we know that. So we want to make sure that there are proper procedures in place. One of the things I do want to give you is that AARP has a financial guidebook for caregivers. It's called AARP's Financial Workbook for Family Caregivers, and that is found on our AARP webpage. And that's a good place to look at if you want assistance with that. There's also a financial guidebook for veterans and military family caregivers. Those are on our website too. Let's talk about financial or legal affairs. It's important to get these legal affairs together because as things progress, legal matters come into play. And if legal matters aren't taken care of when you're able, it might be difficult and costly in court afterwards. So, some of the things or some of the conversations to add to help with these legal affairs. Advance directives. Spell out the individual's wishes and designate who will make those medical decisions for them if they're unable to do so. We have documents like power of attorney for healthcare, living will, do not resuscitate. And then we have PULSE, which is the physician's order for life-sustaining treatments, and medical orders for life-sustaining treatment. That's a lot. That's a big word. So if you get really good at saying that, great, because I always seem to trip up over those. Power of attorneys for property and finances. This allows a designated person to manage these matters if the owner is unable to do so. Um, this helps with financial institution, governmental agencies, Social Security, Veterans Affairs. Social Security allows you to have a representative payee, and for veterans, there is a fiduciary agent that can be appointed. Then we have estate planning documents. But where can you get these help? Of course, you can always go to an elder law attorney and estate planning attorney. Those are all great things. Some resources might be the National Association of Elder Law Attorney, the National Association of Estate Planners and Counsels, and the American Academy of Estate Planning Attorneys. They all have directories. They have for us to get in contact with to help with these types of things. Of course, we have some free legal uh, entities here in Utah, but they are very busy. So chances are you might not be able to get assistance through them, but it is available here in the state of Utah. Next is a functional assessment. And the functional assessment can help determine your loved one's care needs. It evaluates their abilities and skills for everyday living. In other words, how they can function on a daily basis. So these are those activities of daily living: getting up, grooming, toileting, transferring from their bed to a wheelchair or to standing up, to chair to toileting, walking, climbing stairs, etc. Um, as a person progresses through their caregiving needs or through dementia, they might not be able to, um, they might be able to get up and get out of their bed, but they might not be able to figure out how to get dressed, or they might not be able to climb stairs very well, or other different types of things. So again, we're looking at how they're living their daily life. Other things are instrumental activities of daily living. Is the safety, is that an issue in their house? Emergencies, shopping, meal prep. Do they have problems taking medications like my father did? He started taking his night pills instead of taking his day pills. Communication. Um, with different types of dementia, they might not be able to hear you. And as things get worse, they're not ignoring you. It's just that there's a communication issue. Pet care is one that's important too. If they have lots of animals, are they able to go around and take care of those animals? We know the importance of pets in a person's life and helps with isolation. So think of that too. Is it too many animals, or do they need to get down to a certain one? Or is it just the fact that you need to make sure that that pet's there for them? Healthy habits like hygiene, exercise, nutrition. Unfortunately for us here in the state of Utah, I found out recently that Salt Lake County has the highest rate of malnutrition for older adults. It's sad that we live in a world where older adults are malnutritioned in Utah, and they're passing away because of those bad nutritional habits that they have. Um, Make sure that they're eating. Make sure that they're eating the right stuff. That I know that the person thinks you can live off of uh, uh, Cheetos, cream soda, and cigarettes, but that's not how it works for everybody. Unfortunately, that works for my father-in-law, who's disabled, and he still is healthy in some ways, but that's not the best type of nutrition that you want a person to have. Have that conversation with them. Like, we need to bring some other type of food in here that you need to have more stuff than cream soda and Cheetos. Then, of course, we have cognitive skills as dementia and Alzheimer's is creeping in. Is their problem solving being affected? Is there attention? Do you need to have some technology that's in place to help it? And then, of course, then safety issues. Are there tripping hazards? Are there other types of hazards within the health? And you and your caregiving team can go through these and provide support over time. But it's good to do this assessment, see where they're at, where things are progressing, and go from there. Healthcare, healthcare is such a great thing. It's great that it's there to help us, but at the same time, the maze of going through healthcare assessments can be kind of a problem. Doctors are required to give you your medical history, but keeping a list of all the doctors that you go through, all your medications, list of providers, and then on top of that, you throw your insurance coverage in. You have to understand what's covered, what's not covered. So, as you're doing this plan or this assessment, you really need to understand their medical history and make sure that more than one person knows about it. So get those medical records, get those VA medical records, create that list of medications. Most prescription drug plans or Medicare Advantage plans will provide a list of the ones that you frequently take or you go and get refilled. Make sure you're sharing that with your team members or your caregiving team, that they understand if you're not available, that somebody can go do this. Tell them about all their doctors. Don't keep it a secret. Make sure all the providers involved are aware of each other. I met one person down in Moab once that had 12 different doctors, and 12 different doctors providing 12 different lists of medications. And I would ask her if she would ask those providers if one medication is negating another one. So make sure that all your providers are aware of what has been added, what's been taken off, so that everybody's on the same page. course, you have your health insurance. Make sure everybody knows, do you have Medicare, Medicaid, VA healthcare? What type of insurance is there so everybody's available and is all on the same page? And there's usually some type of health information that you can usually keep digital copies or put things on your phone. Medicare used to have an app that you would be able to go into and you could see specific things. I'm not quite sure if they still have that or not. But if the insurance company has that, use it. So next is socialization. Now, it depends on the person. Spending time with them and them spending times with others can be very critical for both physical and mental health. And isolation is very bad for your health. And there are some people who just want to be isolated. And no matter what you are trying to do, they just don't want to do it. So, as part of this team and your loved ones, what are some ways that you can help get that connections, but at the same time, not overstepping that person's boundaries of, not really wanting to go out, but spinning them at different ways. Maybe that it's, they feel like they can't go out in public because they'll get sick or whatever. you know, the risk of isolation can be fixed in many different ways. You don't physically have to go out. You can do virtual things. You can have a person talk to a friend on a phone. They can do the video chat. They can actually just talk to them. And if they feel comfortable, you can meet up in a place where in-person socialization is okay to their needs. Make sure that you're ensuring connections with family, friends, and neighbors. Make sure that you're informed of long distance caregivers that are out there. If your care team is here in Utah, but one person is in Idaho, make sure that they're part of these conversations too. That I know it's important, but you can do the virtual options to make sure that they're socializing with your group and your team, but also the person that's receiving the care. I mean, the my father and his sister, they both have their forms of dementia, but they can't meet in person. But it's amazing how wonderful they feel and react because they can talk to each other on the phone and have conversations and reminisce about things. And it's always funny to watch them try to handle technology where one's turned away and one's not looking at the phone. But, that's how we interpret it. And to those two, it's the best time in the world. Even though it doesn't look right, it doesn't feel right, you know, it's perfect for them because um, they're not alone because they're talking to their brother or their sister or somebody else that's important to them in their life. Housing assessment. So, what type of coverage do they want to live in their current house? Do they need to move to a different community? Most people want to age with dignity in their home because that's what they love. That's what they want the most. But at times, their house might not be the safest place. So that assessment needs to be evaluated at the very first and reevaluated over time too. So is it safe in a term of mobility? Are there fall hazards? Do people have access to them where fraud may come in? Does their home need repairs? Does their yard need repairs? Is it still comfortable for them? If a person has to live on the first floor of their house because they can't go up any stairs anymore, is that still comfortable for them? Or are they being too isolated because they can't get anywhere else in their house? Think about services and modifications that might be helpful to them. Simple things like a ramp going in and out of their house to help them come in and out to help with the isolation. Um, Ramps aren't as expensive as they used to be. I go to a place called Discount Ramps for my father-in-law, the one that likes to have the Cheetos. He's in a power wheelchair, and we put in a new door for him. The door, however, from the old one to the new one, made it so that we needed to put a little ramp in and a little ramp out his door so he could get over his threshold. Of course, we didn't know how to do it, but going to ramps online in different for us it was discountramps.com. They provided all the specs and showed it, and it was a short fix for less than a couple $100. But now he's able to get in and out of his house. Those types of things are there for you. You don't have to just go and sit at Lowe's and, be standing there looking at a wall of stuff and not know how to do stuff. There's lots of different options that are available, and you can look at those things. If it then gets difficult for that, do you need to change your housing? Do you need to start thinking about a smaller home or an assisted living or a skilled nursing facility? There are a lot of different options out there. There's a lot of local agencies that are out there to help with that. Talk to the local area agencies on aging to help with this housing assessment. And as you are going through these things, of course, you want to make sure it's safe for them to be there. But if not, AARP also provides some booklets called the Home Fit Guide that helps you evaluate every room of your house to see if it's a good fit for your loved ones. We also have a Veterans Home Modification Benefit Guide that helps talks about different types of modifications for veterans. Transportation, transportation is, getting people where they need to be. Um, are they able to drive? Are they not able to drive? Can they do rideshare? Can they do public transportation? Um, I remember a long time back that we needed to change the transportation issues for my wife's grandfather. The reason why is he could drive, but he just had this hard time of not scratching cars as he drove down the road. So after 4 or 5 times that he scratched the neighbor's car or somebody else's car because he thought he had plenty of room, we needed to have the talk. And that talk was whether or not he should be driving. And that was a difficult conversation for him. He didn't want to take the bus, but he was willing to walk different places. But for sure, we had to take away his keys. The sad part is he figured out where the keys were every time we'd move it. So eventually, we then needed to remove the distributor cap to his car. And even though we had this conversation with him, he was very defiant about it. And of course, I know why, because you're losing a part of your independence when you have this conversation about transportation. So again, if they're open for things, ride sharing is a new thing. I'm not just talking about Uber or Lyft. UTA has a ride share program that is very successful. You just have to plan a little bit ahead. Some places to hospitals and other types of facilities, they have prearranged shuttles that you can work with. Um, but it's good to help because if you're just saying, I'm going to drive you everywhere you need to go, and you don't have enough capacity to drive that person around, what are you going to do about it? Are you going to let them do the driving, or are you going to leave it up to them to figure it out? Or are you going to leave it up to you to figure it out? You got to have this conversation because most of the time that we need to talk situation is where they're no longer able to drive for themselves. So now we move into home and community-based services. Um, I love these programs because they do so much. They help care for your loved ones beyond what you can do alone. And these types of services are great. Um, all so our local area agencies on aging have the information for home and community-based services. They're low cost, sliding fee scale or free depending upon your income. And Just a couple things that are available. We have home and community based, which offers congregate meals, which is meals at a senior center, home delivered meals, adult daycare, personal care, home care transportation, emergency response systems, home modifications, legal and financial assistance, and of course, respite care and caregiver support. So, of course, contact your local area agency on aging. If not, there's an elder care locator that you can put in, and they'll tell you where the local area agency on aging is. There's also the VA. The VA, depending upon your eligibility, has lots of different things too, like medical care, home health care, supplies, grants for home modifications too. Then we have facilities like independent living homes, assisted living, nursing homes, and then we of course have care and care managers or case managers. Um, they can help with long distance caregiving. They can help find and coordinate and monitor care and services. There's lots of different ways that they can help. So the Aging Life Care Association has a search tool that you can find care managers in their area, and that's at aginglifecare.org if you're interested. Next is technology. I, it surprises me how over time all these different types of things have come out just to help. And now technology is helping us. This with technology, there's things to help with safety, which is like the personal emergency response systems. We have sensors for motion sensors for lights and alarms and bed chairs and alarms. Then we have telehealth, which is awesome to help with virtual phone or video appointments with providers. It's fast and easy. Actually, sometimes you get better service through telehealth because the person has more time to talk to you because you're not in the office and they can just do it on the computer system. Then, of course, we have mobile technology when it comes to help practitioners with the ability to come to your home and provide care, like lab tests, x-rays, ultrasounds, the therapies that are out there, and more. And we have healthcare monitoring devices, which track your data, like pacemakers, blood pressure, blood sugar. I mean, all of us have our watches, right? Things are getting to where things can be monitored on your watch or something that you're wearing. Of course, we have our smartphones, and then we have apps with technology for finances. We don't have to go to the bank or the credit union. We can just do them on our website while we're there, helping take care of that person. So let's get into the last part is about the compassionate care. And it's important to talk to your loved ones about their wishes and their options for compassionate care at the end of their lives. Um, when I worked for aging and adult services, most of the conversations were people just trying to get around this. They didn't want to have this conversation. They're like, well, when I get that way, I just want somebody to put a bucket of chicken over my head and leave me out in the woods and let me wander. And they thought that was really funny, and you kind of laugh back. But that's not how they want to be treated when it gets to that part in their life. You have to have these conversations about palliative care, hospice care, what's happening as they get older, funeral arrangements, crazy stuff like just funeral arrangements. A caregiving team will know exactly what the person wants for their funeral. Most people, if you have a family of maybe two or three kids, I bet you have two or three different ideas of what mom and dad want when they haven't really asked. It was when I was driving my mom up to this funeral over the weekend. Um, she finally told me their funeral plans, and because I hadn't really thought about it, and at the same time, I I knew that my dad wanted to be buried, but I didn't understand to what extent he wanted it. And my mom was kind of like, well, I don't know. I'm kind of vacillating back and forth between having a funeral or being cremated. I had never thought my mom in her entire life would think about being cremated. And so we talked about the different options, and we talked about different options since my dad was a veteran, whether or not he may be eligible to be buried at the VA cemetery in Draper. Those conversations have to happen. And I think over time, as you're having these conversations about other things, they're going to be more willing to open up about stuff. But what you don't want is the fight after a person passes away because half the group says that the person wanted to be cremated, and the other one said no, not in their lifetime. They want to be buried. So you have your plan. I know I've taken a lot of time, so I know we're getting close, so I'm going to move over to let's talk about your team. This is your team that you're building. You have to determine, you have the assessment in place, you have an idea of what's going on, but you need to build your team. You have your family and friends, you have services, you have caregiver support, and you have professionals. Your list of things that you're juggling, okay? You have family and friends. On that list, you can put on the list of things that you can't do and what needs to be done.
Hello, everyone. It looks like Darren is frozen. Hopefully, he'll be able to um, rejoin us in a minute. Um, he has mentioned he's had some issues with Zoom and he's able to usually quickly log back on. So hopefully, we can give him a minute to rejoin. In the meantime, I'm going to send a link via the chat where you can complete an evaluation form. And we have myself and Christy and Kate are both here, and we can get started with Q&A. Now, if anyone has any questions, you can use this Q&A function at the bottom ribbon of the webinar, the Zoom window, and send us your questions. Okay. And there's that evaluation via the chat. It looks like
I'm
it's back on. Hi, Darren.
so sorry about I warned you, right? Oh my gosh, Zoom hates me for some reason. I maybe it was just tired of my conversation. I don't know. I'm sorry.
Well, that's just fine. We've gotten people started on sending us Q&A if they would like to. So if those come in, we can um, address those. But if you'd like to reshare, you can um, go back and finish the presentation you have for us.
Yes. Oh my goodness gracious. Let's pull this back up here. Good times. Okay. Oops. You're like, what was he going to say? What was he going to share with us? Okay. Am I sharing the right screen? The presentation screen?
No, it's the PowerPoint screen.
Okay. Let me get this going. It's the PowerPoint screen, right?
Now it's your PowerPoint with your notes.
Notes. There we go.
There we go.
So you're like, oh, I saw pins and needles. It was so close, but now it's going to happen. All right. So we were talking about building that team. And I know, like I said, it's getting close to the end. Get people involved, especially with people with dementia and Alzheimer's. That list that I kept talking about, expand that list because you need as much assistance as possible because it's so draining. And at the same torch, you need to think about yourself as you're providing this care because self-care is just as important as you're building this team. So, tips for self-care. Just I'll throw this in here. There's lots of emotional and mental health. You don't think you need it. You're too strong. Oh, I can do this. I don't need any help. You're wrong. You need help. You need support. You need counseling. And of course, you need respite. You need these services. So keep this in mind as you're doing stuff because you need to provide self-care. Of course, grief after life and after caregiving. That's what I mentioned earlier. I talked to her about taking some time, my aunt, whose husband just passed away, but and getting her involved in other things, grandkids, community, honoring the life. But, because at first she just said, well, I'm not caregiver anymore, so I guess I'm just going to go home and clean up. We don't want that to happen. We want her to get help and support, but also honor the life of the loved one that passed away and help. We're going to try to help her with setting some goals. So in summary, this is all the things we covered, doing the assessments, having the conversations, creating a caregiver plan, caregiving plan, and then life after caregiving. Here are some resources that AARP offers. This will be shared with you in the group. So all these things are here. One of the last things I want to point out is it's called Your Questions Answered tool on caregiving for AARP. It allows you to type in any type of question that you have, and you select the caregiving tab, and it will go through a database of all the answers that we have there, and it'll give you your question. It'll help answer your question. So when in doubt, you can always go to this page, type in a question, and AARP has the answer for you. So thank you. I appreciate it, and sorry about my computer. And so I will stop sharing, and we can answer questions.
Thank you so much. One of the questions that's come through is what are some ways that we can help family, friends, people who are taking care of elderly, parents or loved ones who are at a distance?
So one of the things virtual is actually talking with them and visiting with them, helping them with that isolation because you're not there. Periodically visiting them, but maybe this is where you plan, if you can't be there in person, plan some vacation to come do it, or be that financial contributor from outside of the state to help support with other things. Pay for somebody to come in and provide respite care. Pay for somebody to deliver meals to their, do some of those food programs where they can have the food in their house. Pay for a maid service, cleaning service to come in and help out. Anything else you guys can think about? Money always works.
A fun thing that we've done, we help provide care for a family friend in another state, and we actually will send a pizza to her house and have pizza at our house and join a Zoom call. So it's like you're eating together. Um, it provides that social, but it also provides that meal and a break for the people that are there. I think having the discussion of if there are other caregivers that are closer, what are their needs? What you showed that chart with all of the tasks and things. What can you take off of that plate? Whether it's scheduling someone to come in and clean the house or scheduling someone to mow the lawn or grocery delivery or whatever.
Yeah, and also, and Christy brought up a good point. You can send pizza or maid service to the person who's taking care of that person too. Show them some love too. We always think of the person receiving the care, but we need to also show love to the caregiver.
Absolutely.
Thank you. And I'm going to take a bit from another question that we got, which is just if someone wants to say a little bit more about how we balance sensitivity with transparency when providing care and when talking to people who are going through a dementia diagnosis.
I think I answered it initially, so I'll continue on in my thought process there. It really depends on both the caregiver and the care recipient and where they're at in that disease process. I'll use my life for example. I have a grandmother with Alzheimer's disease. If I say dementia or Alzheimer's, she gets really upset. She doesn't have it. It's very traumatic for her. And so what we have opted to do is we don't talk in front of her about that. And that helps us get what we need done, and it helps her not be so stressed. That being said, there's a lot of opportunities for caregivers and care recipients to work together. And it was specifically about viewing the webinar. You can learn together, and it kind of helps start those conversations because while Darren's talking about planning ahead, you can say, hey, why don't we have that discussion too? And it kind of helps with that planning process. It really is just dependent on the family situation and what's going on.
Thank you, Christy, and thank you, Darren, for sh sharing this last slide. So again, if you can please complete this evaluation, it really helps our team know what you're enjoying, know how to improve, and gives you an opportunity to give us feedback. So you can use that link that's in the chat as well, or the QR code. And then we're just about at time, but we have one more question. Um, about, let's see, if there are any digital solutions or if there's something that we can maybe refer people to that can help prevent fraud early on. So preventing fraud when someone is diagnosed with dementia.
Oh, a lot of that, uh, I think a lot of it is at the early parts of dementia diagnosis. If you help them start to put most of their stuff behind passwords, pass keys, and other protection things on their phone, because I think that's one step of doing it because most scams come through their phones and it's one click process and they can get these things simpler and faster. Where if it's behind a password or a pass key, they might think about that at first. And as things get difficult, you can change those passwords and passcodes so that the caregiver knows what it is and the person can't use those funds if they're unable to distinguish between right and wrong on those particular scans. But since everything's changing, the first step is putting behind passwords and pass keys and password managers, just so it makes it one step process, another step process before they can just send money and stuff like that.
And I know we worked with a family who was struggling with cell phone fraud. Like somebody was calling them and saying, we need this money, and then the person would just send the money. We discussed with them switching to a phone that's typically made for children, but only phone numbers that are programmed in the phone can call and text that number. And so you're not taking away their cell phone, you're not taking away their independence and ability to communicate, but you are protecting them from unknown phone numbers.
Mhm.
And so I thought that was a unique option as well.
Yeah, you can do that for other people for their phones too. I've called somebody and it says, "What are you calling for? Who are you with?" before they'll even let it get to that particular person.
Awesome. Well, thank you to our panelists and a special thank you to Darren for presenting today. And thank you to all of you for attending.